Hi, my name is Professor O'Malley, and I am an expert on gender dysphoria. Today, I will be teaching you guys a little bit about the standards of care for the treatment of gender dysphoria, the advances that have been made in that area, but also some of the kind of neglected areas of it. One other thing that we will touch on is also the treatment of youth individuals who have this, but it's not quite the same process, and so it is not going to be the main focus. I think what would be best is if we go ahead and look at what would be a typical example of someone looking for treatment for their gender dysphoria.
Jordan, the doctor will see you now.
Hello, sir. I'm Dr. Smith. Oh, sorry, I must have the wrong room.
Oh, are you looking for a Jordan? Because that's me.
Oh, so what brings you here today?
So I've been seeing a psychologist. They told me to come see you for possible care treatments for me.
Treatment for what?
Gender dysphoria. I've been seeing them for about 3 years, but I couldn't get treatment before because I was underage, but now I'm 18. So they said for me to come see you. Here's all my paperwork from them.
Okay, let me take a look at this paperwork. So it looks like you've been seeing a psychologist for at least a year. You're at least 18 and have been living as your preferred gender for at least a year. Have you started hormones, or are you looking to start them?
No, I haven't started them yet. I've been looking to start those.
Okay, just so you know, this is a complicated process. Treatments are very expensive and insurances generally don't cover it. Also, with taking hormones, they could have problems with your liver and kidney function. Are you comfortable with taking this risk?
Yeah, I've already looked up all this stuff. I know all that already, so I'm comfortable taking the risk.
Okay, well, I'm going to need to take some time to look over your paperwork to make sure I'm comfortable with treating you.
Let's see what Professor O'Malley has to say about this.
As you can see, this doctor is not very thrilled about treating this patient. Unfortunately, that is one of the major problems with the standards of care for gender dysphoria, is that doctors really get the final say in who gets treatment and who doesn't, for basically whatever reason that they want. This can also lead to problems for people who, like Jordan, are not yet confirmed for surgery and who are still thinking about it, because those who are confirmed for surgery are generally the ones who are getting the prescriptions. Now, that being said, there are also no licensed indications for the prescriptions that are used for those with gender dysphoria, and that can lead to people who get those prescriptions being denied access to them even then. At the same time, there also aren't any laws protecting people who are seeking treatment for gender dysphoria, and it can cause some issues with getting treatment for really any medical condition that they are seeking treatment for, such as even going to the doctor just to get a physical examination done. Doctors can refuse based on the fact that their patient is a transgendered person. So let's get back to this example that we're looking at and see how it goes from here.
Thanks, Professor O'Malley. Now let's see how this plays out.
Okay, well, I was under the impression that this was going to be a lot simpler because I was trying to do this for years now, but since I wasn't 18, it was basically impossible.
Wow.
Hold up. Professor O'Malley has a few things to say about this, too.
Jordan has a valid point here. Transitioning is an extremely hard process to begin with, and for youth, it can be even harder. There's 6 main issues with the youth care for gender dysphoria. First off, there are few people who are trained to treat people with this sort of condition, and there are even fewer people who are trained to treat young people with this condition. The second thing is there's a lack of consistency with care within the entire process itself. Third being there's a lack of consistency with the pronouns and the names that patients want to be called by. The fourth thing being that there really generally isn't coordination between doctors. The fifth issue is that there's a huge limit and delay to getting these puberty and hormone blockers for youth individuals. And lastly, the one of the bigger issues is the fact that insurance is even harder to deal with for youth individuals. But altogether, all of these are known problems for everyone. They're just made worse if you are under the age of 18. So let's get back to what the doctor was saying.
Okay, now you can finish.
Well, I would never prescribe hormones to a child, but that's beside the point. I'll get back to you within a week with my decision.
As you can see, this doctor is skeptical on providing treatment. And as we've already covered, there really isn't any law restricting their refusals. However, these refusals have declined recently in years due to growing awareness. There has been a movement to induce care for gender dysphoria into more facilities for easier access. Since this development, there has been a big increase in patients seeking help for gender dysphoria. Increased awareness and easier access can be accredited for the number of people who are now receiving care. Services have been developed in normal mental health settings, but also in new alternative areas. Oftentimes, these alternative service providers were already distributing hormones for one reason or another, so it makes sense for them to allow access to the hormones that people with gender dysphoria or who are transgender need. Development of sexual medicine has also become a specialty and is becoming more common than ever before. Because of this, people are becoming more comfortable with caring for transgendered individuals. So why don't we look at an example of how things are becoming better?
Hi Jordan, how are you today?
I'm good, how are you?
I'm good. So I see that you're seeking treatment for gender dysphoria and looking to potentially start hormones. I see that you already started hormone blockers, is that correct?
Yeah, I have.
Awesome. I received your paperwork from the psychologist and everything looks good as far as your requirements for starting hormones. So we'll start you on estrogen and continue you on testosterone blockers and see how that goes. Do you have any questions for me as a medical professional and not a psychologist?
So I know that costs can vary depending on insurances and different treatment plans already, but I was just wondering if you would know maybe a ballpark of what mine would be.
Well, a lot of insurances do not cover everything, but more and more are starting to, depending on if you want surgery or not. Prices can range for surgery anywhere from $30,000 to $150,000. For a better estimate, I recommend that you talk to your insurance company.
Okay, thank you so much. You've been so helpful.
No problem. We'd like to check in with you soon to make sure everything is going all right, but if you have any questions in the meantime, feel free to contact me.
Okay, well thanks again for everything you did today.
No problem. Have a good day.
You too.
One more thing from Professor O'Malley before she goes.
Now this is an example of the ideal situation, and while we're not there yet, we are getting closer every day. So for anyone who is needing more information on gender dysphoria, or for anyone who is just curious, we do have some resources available to you. So thank you for watching. See you later.
We in no way want to offend anyone who has experienced gender dysphoria or anyone who is transgender. This was a dramatized skit that we hope can inform others of some of the hardships and obstacles that individuals experiencing gender dysphoria or individuals who are transgender have to face. We also want to point out that we know not everyone who experiences gender dysphoria is transgender, but that is just the aspect that we chose to cover in this video. Thank you.